In August 2006, at the age of 59, I was diagnosed with stage 2 breast cancer, for which I had multiple scans, tests and biopsies, followed by surgery for the removal of tumours by 2. After pathology results came back, I had to have surgery again 2 weeks later for a partial mastectomy. After convalescing for approximately 6 to 8 weeks, I found very minimal psychological assistance was available to me. I had one and only one session with a breast care nurse at the North West Regional Hospital and a session with a social worker post almost 8 weeks of radiation in Launceston, followed by 5 years of medication therapy. Boy, the medication therapy sure had its downfalls with multiple uncomfortable side effects. The financial burden involved was no easy task, being unable to receive any assistance from Centrelink. Without my partner and family support during this difficult time, I don't know how I would have managed emotionally whilst having 5 months off work. God willing, I'm now 14 years this month, now cancer-free since my diagnosis. I worked as a nurse, now retired at the age of 70, at the Smithton District Hospital and several hospitals in New South Wales during my nursing career. My main role was predominantly working with palliative patients and their families. I gave this role my all as a nurse, a friend, a confidant to my patients and their loved ones. I was constantly delving into whatever literature, courses, etc., and the latest updates so as to be able to give the best possible care. To gain patients and their families' trust is of utmost importance, trying to keep the atmosphere as normal as possible and not to take the morbid approach. Our local area is going from strength to strength with the much needed provisions for all types of mental health, medical and physical help. Support groups such as Emerton Park, CHAC, Windara, Rural Health, Community Health, to name a few. Transport to treatment is a godsend, which was the result of the Relay for Life by 2, which was conducted over a few years. The people of Circular Head have been extremely generous with their donations towards this cause. The vehicle transports patients from Circular Head to their appointments along the coast. The vehicle is driven by local volunteer drivers. We now have a radiotherapy machine at the North West Regional, which is also a godsend for the North West and the West Coast area, which became possible through the generous donation of a prominent, well-known gentleman, namely Mr. Elphingston. It's been a great asset as it has reduced the need for patients to travel to Launceston. I also had the pleasure of working with Dr. Tharaka Marin, who worked as a GP in Circular Head, whose background is specialising in palliative care, who has a great rapport with patients, family, staff and his fellow GPs. I will do my utmost to assist where possible with being a go-to person or whatever people need to require assistance with. Bye.